Ultra106.5, you're on the home run with Dave this afternoon. And this morning, a report was issued, Too Hard, Highly Vulnerable Teens in Tasmania. And to find out a little bit more about what that means, Dr. Catherine Robinson from Anglicare is joining us. Catherine, welcome.
Thank you very much.
Hard, vulnerable teens in Tasmania. Too hard?
No, they're not too hard. You'll note that there is a question mark after that too hard, and it's an important one. People think that these kids are too hard. This report shows there are clear things that we know that work, that can be done to make sure they're safer during adolescence.
What sort of things are our teens presenting with as problematical and troublesome?
Sure. Look, this report focuses on a really specific group of teens who experience harm in their home environments. They leave those environments and go on in adolescence to experience homelessness, poor mental health, drug and alcohol use, and suicidal behaviour, and many other adversities as well. I guess I'd just say that it's a very specific group. We're not talking about the whole teen population in Tasmania, clearly, but it's a small enough group that we should, in a state like Tasmania, be able to do better for them.
What is it that we can do to help these kids, and why are they missing out now?
They're missing out because often they're coming from families with a very low income. These families are not able necessarily they don't have the resources to look after these kids in some cases. And as I said, abuse and domestic violence are also key issues that they experience. However, the child protection system is not able to provide a response to all young people who need it. And indeed, some young people just simply won't meet the threshold for child protection to become involved. So what the report argues is that in that circumstance, there needs to be other care options for those people who are left outside, if you like. So these are young people who are not able to live at home anymore. They're not in the child protection system. So we need to create new, innovative, medium and long-term residential care facilities for this specific cohort.
This is a way, I suppose, also of tackling the issue of teenagers that do either the couch surfing or even are sleeping rough at the moment.
Absolutely, and both of those experiences featured in the young people's life histories, the young people who took part in the research. More so than I expected, actually. I would have thought that the use of crisis accommodation might have been more prevalent. But again, what we're seeing in Tasmania is that those services are often full, and so there will always be young people who are not able to access a safe bed.
So, Catherine, what can we do to increase the number of beds available within the constraints that we've got of our budgets?
Well, there are always going to be constraints, but I think it's just a matter of prioritising within those constraints. So it's clear that new resourcing is needed to create services that actually align to this cohort's needs. Those services aren't there at the moment, and so we actually do need government to make it a priority to get them in place.
It's a tough one with teenagers because they go through that difficult time in life, don't they? And when they're going through that stage and they're challenging, sometimes it's just easier to throw your hands in the air and say, oh, it's too hard. And it's not really.
No, and you have to remember, these aren't teens who are just having a difficult time. These are a group of young people who have survived very severe childhood adversity and who go on during adolescence to experience further adversity. So these are young people who experience complex trauma. So we're talking about quite the need for quite a specialist response to this group. And again, we know what that response needs to look like. So it's not that this is a mystery. It's not too hard from that perspective in that we lack understanding. It's that we lack the political will to put the resourcing in place to provide the services that these young people need.
It's a biblical principle that things that happen to the next generation and the next generation and the next generation. Is that an intergenerational problem here?
Absolutely. A lot of the young people who took part in the research, their parents had had similar experiences to them. And so, again, a lot of investment in early intervention, really supporting families, supporting them to hold on to their young people, to stop this kind of situation occurring in the first place.
It's a tough area, vulnerable teens in Tasmania, but as you said, certainly some more resources needed to be added into this. What's the next step?
Well, the next step is to continue to put pressure on government and to continue to advocate on behalf of this group. We'll be briefing all the relevant departments, and I guess we are just open to collaboration. There are many people in the Tasmanian community, many services, many in government agencies who want to see Tasmania doing better on this issue, and we are open to collaborating and forging that pathway forward.
Well, we thank you and all the team at Anglicare for putting this report together. I know it's taken many, many hours of work, and we also thank the kids that have put their hands up to say, well, actually we'd like to see something being a bit different.
They were fantastic. Their participation absolutely was critical to the project. They were so courageous in talking about their life experiences, very articulate and very resilient. And without them, I wouldn't be able to have this opportunity and honour, actually, to speak on their behalf to the broader community.
Well, it's great to be talking about the topic on the Home Run this afternoon, and we thank you very much for your time.
Thank you for having me.